Some other news to cover for you, and here are the latest COVID numbers in our area.
In New York State, Governor Cuomo now reporting more than 8,500 new cases, along with more than 8,000 hospitalizations and 141 deaths.
And in New Jersey, Governor Murphy says there are more than 3,800 new cases, nearly 2,900 hospitalizations, and 34 new deaths from COVID-19.
Connecticut's Governor Ned Lamont now reporting nearly 4,000 new cases since Friday, along with 912 hospitalizations and 73 deaths.
COVID vaccination appointments are canceled today and tomorrow in the city. Meantime, new data is showing many in the hardest hit communities have no intention of getting the vaccine.
CBS 2's Aundrea Cline-Thomas explains how leaders across the tri-state area are addressing these concerns.
We have the information that we need to take action today.
After weeks of promises pledging equity would be at the center of the COVID vaccine distribution efforts, new data shows the plan is not working. Of those that have taken the vaccine in the city, only 15% are Latino, 11% are black, compared to 48% who are white. A large divide when considering each group's share of the population.
If we get a bigger supply, I think that's the single biggest difference maker, because what that means is in communities all over the city, people start to know more and more people in their life who have gotten vaccinated.
It's a concern across our area.
Black and brown, 60, 65, 75, are much more likely to get infected and much more likely to suffer complications.
In New Jersey, only 3% of vaccine recipients are black and 5% are Hispanic or Latinx.
Some of the efforts that have been made to get people to get vaccinated are not necessarily as accessible to underserved populations.
Dr. Denise Rogers serves on New Jersey's Minority and Multicultural Health Advisory Commission that's addressing the issue.
How do we get trusted leaders from the community to advocate?
The hesitancy is rooted in long-standing distrust of the medical community, which could have a deadly impact in already hard-hit communities like Queens.
We saw individuals of color from our communities getting it, so we're going to have to do a lot of that, and I'm going to have to even pull my sleeve up and get a shot in the arm to build that trust.
It's a race to get buy-in as the virus shows no signs of slowing down. Aundrea Cline-Thomas, CBS 2 News.
Mayor de Blasio says that he has identified 33 neighborhoods that will receive targeted outreach in different languages.